today. I am the Director of Community Engagement and Partnerships for the Office of Supervisor Vargas, and I'm also leading all of our COVID efforts. So any questions that you might have, anything that you're hearing in the community, please reach out to me. Send me all the information that you're seeing as you're on the ground. My information is in the chat, and I'm looking forward to this conversation.
All right. Entonces quiero recordar, como les había comentado, quiero tener este formato de mesa redonda porque he escuchado muchas inquietudes y lo primero que quiero hacer hoy es brindarles una actualización sobre las respuestas del condado ante COVID y qué es lo que está pasando con las vacunas y las pruebas. Y les presenté a todos a Griselda, que es parte de mi equipo. Griselda, can you say it in Spanish?
Buenas tardes, me llamo Griselda, soy parte del equipo de la supervisora Nora Vargas. Soy la directora de Community Engagement y asociaciones y soy el contacto para todo lo que es relacionado con COVID-19, cualquier cosa, inquietud, cualquier cosa que estén viendo mientras ustedes están haciendo sus trabajos o están escuchando en la comunidad. Me encantaría que me manden la información o cualquier duda me pueden llamar. Puse mi información en el chat y estoy preparada para escuchar la conversación de hoy. Gracias.
Muchísimas gracias, Griselda. Just to start off, I wanted to share some information. So today, we have been able to administer over 3.5 million COVID tests in our community. In San Diego County, we now have 4 vaccination sites, and including one in the South Bay. There are 15 smaller pods with 7 of those serving South County. Así que hasta la fecha hemos podido administrar más de 3.5 millones de pruebas de COVID en nuestra región. El Condado de San Diego ha abierto 4 superestaciones de vacunación, incluyendo una en el South Bay. Así que tenemos 15 centros en total en el condado de vacunación y con 7 de ellos están ubicados en el sur del condado. Para mí es importante mencionar esto porque es importante de todos los nuevos sitios de examen que tenemos para COVID, muchos de ellos los estamos transformando para la vacunación y es importante porque la gente tiene conexión con la comunidad y ya saben en dónde está. So I want to make sure that I emphasize, and I'm getting a text from Olympia. Can you make sure that she gets the Zoom? Someone, Nirvana, please. Thank you. I know some people were asking for the connection and they didn't get it, so I am wanting to make sure that everybody who wanted to join joined. And so wanted to emphasize that there were 4 that what's really critical about these stations that are taking place now is that we were very mindful at the county team, on making sure that the COVID locations were actually in areas where our neighborhoods were at, and then we were actually focused on ensuring that it's where people actually feel like, they actually know where that they have access and that they've been there, et cetera, et cetera. So I want to emphasize that before I was elected, my team was already doing the work on the ground. We were advocating for the expansion of testing sites. The county heard a lot from our communities. We were very loud and clear, and that's why I think we were able to place some of the sites where the data showed the communities were being impacted the most. Incluso antes de ser elegida, mi equipo y yo estábamos trabajando y abogando por la expansión de los centros de prueba, ¿no? Como saben ustedes, el condado escuchó nuestras comunidades y colocó centros de pruebas donde los datos mostraban que las comunidades han sido más afectadas. Now we are ensuring that any investments, including vaccine distributions, are made with a health equity lens. And so to date in San Diego County, there's been 376,503 vaccine doses that have been administered. Así que ahora nos estamos asegurando de que cualquier inversión, incluida la distribución de vacunas, se realice con una perspectiva de equidad y salud. Hasta la fecha, en el Condado de San Diego se han administrado 376,503 dosis de vacunas. And, we've heard from many members of the community about the challenges when navigating the appointment system and not being able to secure an appointment. And we've made a commitment to ensure that we're eliminating barriers, including language and technology. Así que hemos escuchado de nuestros miembros de la comunidad sobre problemas que han tenido al navegar por el sistema de citas y no poder asegurar una cita. Mi oficina está comprometida a asegurarse que podamos eliminar estas barreras como el idioma y la tecnología, ¿no? And so we know right now that the vaccine numbers in communities of color remain low, currently 13.7 for Latinos, 2% for Black, 2% for Asian. But I want to highlight that these numbers are reflective of the different vaccination tiers at the time, which include our health workforce and seniors. It's very important to note the lack of representation of communities of color in the health workforce, which many of you who are on here today have been fighting for to ensure that we have equity at that level as well. Sabemos que el porcentaje de vacunas ahorita en las comunidades de color es bajo, actualmente 3.7% en las comunidades latinas, 2% en la comunidad afroamericana, 12% en la comunidad asiática. Pero quiero enfatizar que estos números reflejan las personas elegibles dentro de la primera fase. Eso es lo más difícil, ¿verdad? Porque incluye trabajadores de salud y a las personas mayores de 65 años. Es importante señalar la falta de representación en comunidades de color en el sector salud, que es un problema que muchos de ustedes han trabajado por muchos años. But we are committed to ensuring we have a strong infrastructure for when tiers open up, and our county staff is going to continue to improve the systems to eliminate any barriers that prevent people from accessing appointments. Así que quiero que sepan que estamos comprometidos a mejorar el sistema para eliminar cualquier barrera que impida que las personas ascendan a las citas cuando sea su turno. My team has made some recommendations, and so what I wanted to do today is have a dialogue and talk, have a conversation with you all, so that you can tell me what some of the challenges might be, and then I can tell you some of the things that we have already been working on, so that it's so that you can hear from us, and we're going to be taking notes. Denise Garcia, who's my chief of staff, is also on here. And for us, this is a priority, making sure that every person in our community gets a vaccination who chooses to get a vaccination, of course. And then any other things that you have may or may have not been seeing. So I do want to share with you that has invested resources and are partnering up with some of the trusted community organizations. So I want to thank some of them for providing education and outreach to the communities already. There's a substantial amount of resources that have been allocated to that. And the goal is really to continue to partner with them to conduct this direct outreach to get our most vulnerable populations vaccinated. So quiero agradecer que muchas de las comunidades de las organizaciones con las que trabaja el condado están haciendo el trabajo. Se han invertido recursos en las comunidades para brindar educación y recursos para que la comunidad pueda tener la información que necesita sobre COVID y las vacunas. El objetivo es seguir trabajando con estas organizaciones para llevar a cabo esta tarea de vacunar a todas las personas vulnerables en la comunidad. Y como les comentaba, Griselda de mi equipo es la persona que está trabajando conmigo y vamos a tomar toda su información, todas sus notas para poder llevar esta información al condado. So like I mentioned to you, Griselda is my COVID task force lead for my team. She has extensive experience doing community organizing and for communities of concern. And so I'm really proud to have her leading these efforts. And so again, welcome. Let's start by seeing if there's any questions or comments from the community organizations. Así que primeramente, bienvenidos otra vez. Y comencemos para ver cuáles son las preguntas y comentarios de las organizaciones y ayudar.
Well, I'll jump in. Hello, everyone. Patty Chavez with Parent Institute for Quality Education. Thank you, Supervisor, for inviting us. Muchísimas gracias por estar aquí. Estoy con PIQE, si lo conocemos de PIQE. A comment and a thank you. I heard you speak this morning at the First Friday breakfast in regards to supporting families, giving them one-on-one support to register for the vaccinations. We have seen that as such a barrier for our families. The digital adoption, whether they have technology, whether they navigated, it's not something they usually did. They were asking for social securities, email addresses. We recently did a survey and we found, like we all know, that disparities continue. 50% of our families don't know how to access medical care online. 1 in 5 still don't have email addresses. So what does that mean in terms of then continuing on and getting a vaccine? So primero las gracias por el condado, por el Supervisor Nora, que estamos mirando lo que está pasando, registrándonos. No tenemos, familias no tienen correo electrónico, no están acostumbrados a hacer registraciones por computadora o no tienen. A lo mejor es el teléfono, uno que está tratando de registrarse o hacer algo con el teléfono es muy difícil. Sí está afectando familias para tratar de agarrar las vacunas, pero también información para COVID. Luchamos todos juntos para tratar de ayudar a nuestras familias. Primero, las gracias.
There you go. Give me a second, David. So I want to say thank you for that. And you know, one of the things that we brought up was that some of the same concerns. And, you know, and I said this morning in the Chula Vista event that I was at. And I said, you know, the system wasn't created for us or by us. So the inequities are extremely real. And I want to just acknowledge that because I think it's really important as government to understand that what we're seeing is a phenomenon that nobody ever would have imagined. And so our responsibility now is try to figure out how to fix it quickly. And part of what I've asked, you know, part of not only myself, but members from, you know, Chair Fletcher's team and my staff and our community, you know, we said, so for anyone who's undocumented, right, we're asking for residency, we're asking for all these documentation, they don't have pictures. And so I think the county team understands that they have to be nimble and that we have to, you know, if there's a question, we just don't turn people back. We really figure out how to resolve that. And one of the ways that they did that is making sure that people understand that the matrícula consular is an accepted piece of documentation for our communities. And then I know that one of the challenges that one of the elders in our communities had was she was, you know, about 70 something, right? Went and she couldn't prove that she lived in San Diego because she lives with her daughter, and her daughter is the one who has the phone bill. And so they accepted that and they were able to give her that. And so I think what we're doing is we're trying to make sure that we're helping the county staff. And, you know, let's be real. A lot of the county staff are people like you and I. Olympia's one of them, right? And not to put you on this spot. So many of us know some of these challenges. What they just need is the go ahead from the county to say, it's okay. Like you can provide and you're not going to be, you know, violating any protocols and stuff. So I think that's the first phase. So let me just say that really fast in Spanish. So es muy importante que todos sepan, y lo comentaba en la mañana, pues que es muy difícil porque el sistema de salud pública, pues en realidad tiene muchísimas barreras y no fue creado para nosotros ni para nosotros como comunidad. Y esta pandemia, pues a otro nivel lo ha demostrado, y lo que está sucediendo es que pues la gente que está trabajando en el condado tiene que seguir protocolos, y lo que nosotros les estamos recomendando y las otras oficinas es que es muy importante que las personas entiendan que a veces nuestras comunidades no tienen la misma información que están pidiendo. Entonces el condado entiende esa parte y hemos trabajado con ellos. Entonces, por lo cual ahora para las personas que son indocumentadas pueden traer una matrícula consular, número 1. Si sus familias no tienen acceso a un recibo, por ejemplo, que nos pasa con una señora que ya tenía de la tercera edad, pudimos hacer ese cambio para que las personas pudieran enseñar el recibo del teléfono de la mamá, ¿no? Entonces, I think what's really important about this is as you're hearing about it, let us know, let my team know. And I think we put the information up there. Griselda put her information on there. The quicker we find out about it, the more we can move. And sometimes it may be, is it a system issue? Or is it a one-person issue? Somebody treated somebody bad. They didn't do the right thing. You know, there's always different ways of looking at this. But I can assure you, you know, and I told this to somebody this morning, I was on the outside of the county for many years, and it was a different board of supervisors. And so my perspective was very different. Being where I am right now, I can assure you that the staff is very responsive, and they really are, you know, stepping up to do the right thing. And so para mí es muy importante que me den la información, que nos den la información como condado a la comunidad. Sabemos que, como decía, yo estuve abogando, ¿verdad? Y haciendo trabajo mucho tiempo, pero en realidad el condado sí está tratando de hacer lo mejor posible. Nos falta mucho porque el sistema pues está mal, pero en eso andamos. Así que Norma and then David, if you guys can put your hand up, I'll make sure that I make sure that you all have a chance to chat. Norma.
Gracias, supervisora Nora. Mi pregunta es, obviamente es el problema de acceso y todo lo que estamos discutiendo. Mi pregunta es, ¿qué podemos hacer también como comunidad para combatir la misinformation que está ocurriendo o yo he escuchado muchas de las amigas de mi mamá, de su iglesia, tienen como duda y no confían en la vacuna. So, tenemos varias barreras, ¿verdad? Incluyendo la tecnología, el acceso y toda la logística para agarrar la vacuna que han discutido. Pero yo también estoy viendo una problemática donde hay mucha falta de confianza y también mala información en nuestras comunidades en español. Necesitamos que más doctores latinos, latinas, estén comunicando con nuestra comunidad para explicar la ciencia detrás de la vacuna y de que tengan, para desarrollar un poquito más de confianza. Entonces, yo sé que ustedes están haciendo lo que pueden, pero ¿qué más podemos hacer como comunidad para hacer más educación pública para que tengan más confianza? So I'll translate that real quick. I just said, of course, there's issues with access, digital divide, et cetera, in terms of just accessing and booking an appointment. And you all have been discussing that. Another issue I see in our community is like the lack of trust and some intentional misinformation campaigns that our community is vulnerable to. So there's like not, so how do we counter that as a community to make sure that our folks are getting accurate scientific information with folks that look like them, that speak like them, so that they have more confidence in even taking the vaccine?
Yeah, man, that's a great point, Norma. And I think what's really critical about this is that it's not going to take just one, advertising campaign from the county or the one that the Latino Health Coalition is doing, or it's going to take all of us together, right? I mean, I think in the African American community, we know that people are skeptical because of the history. Just like in our indigenous communities, that the history of vaccines in our communities has not been a positive one. So to just assume that everybody's going to go get it because, it's something that I think all of us have to work on. But I like the idea of creating, what I was sharing with someone is, like phone bank trees where you help each other out, like in our community. Like, let's go back to grassroots organizing 101, right? And some of that stuff the county doesn't know how to do well because it's not their jobs to do the organizing. But I think for all of us who are organizers, I think we have to put those hats on again and say, ya se vacunó mi vecino, right? Is my neighbor vaccinated? Can I help them? And I think that's what it's going to take in every one of our communities of concern, because otherwise, it's going to be a hard time before we get that. And I will share something really quickly. I'm going to turn it over to David because I know he had a question. That we are in the process of making sure that we are going to be able to take those intakes in person, so that people can actually make those appointments for folks who don't have access to technology. And then the other thing is we need more people who are getting the vaccination. Norma, I don't know how much how powerful it was to have your mom as part of Conexiones last week, and I want to be able to share it more. It was so powerful that she shared her story and how she felt when she got her vaccine. I think we need to do more of that. Así que creo que es muy importante que comunidad trabajemos juntos y hagamos todo lo posible y preguntar si nuestro vecino está bien o no. Y sabemos que tenemos que usar cubreboca y tenemos que tener mucho cuidado, pero es importante hacer eso. David, and then I have David, and then Miriam, and then Jason, and then anybody else who has a question. And if you don't know how to use a little hand thing, because sometimes I don't know either, just go like this and I'll find you, okay? Okay, and then Heno. Okay, David.
Thank you very much, and thank you to you, your team, and I think a lot of people who are here today that are working. Gracias a la Supervisora Vargas, a su equipo, y creo que varias personas que están ahorita escuchando, participando por el trabajo que están haciendo en estos esfuerzos. Latino Equity Council, el grupo mandó una carta con 4 sugerencias de cómo incrementar el acceso. Ya se hablaron sobre unos temas, pero básicamente las 4 ideas y son sugerencias de cómo incrementar el acceso es, ya se habló de lo de documentación. Hoy en día todavía sigue, en la página esta mañana lo vi, para las vacunas en Chula Vista, por ejemplo, donde tienes que entrar toda tu información, incluyendo un correo electrónico y un teléfono, que mucha gente tal vez no lo tiene. Entonces, otra barrera más que ojalá se pueda eliminar para que la gente, porque se requiere tiene una estrellita, entonces se requiere esa información. Si no la metes, no la entras, no puedes hacer una cita. La otra cosa que hablamos es lugares en los que la comunidad confía, porque vemos que los números queremos que incrementen. Como decía Norma, si nuestros papás o abuelitos hablan con la gente de sus amigos de la iglesia, las iglesias son instituciones en las cuales la gente confía. Entonces deberíamos de buscar lugares dentro de nuestra comunidad que sean como iglesias o escuelas donde están nuestras familias, que son de confianza, y ahí tener centros de vacunación. La tercera cosa, ya hablé de los documentos, eliminar eso. Y creo que lo último, y ya con esto termino porque son varias cosas, pero sí sabemos que al principio los que se vacunaron son personas que no representan nuestra comunidad latina o afroamericana porque no están en esos trabajos médicos, pero conforme va pasando el tiempo, lo que queremos ver es que la cifra incremente de los latinos y de las personas afroamericanas. Entonces, lo que creo que pediría adicionalmente es que una idea es de que las vacunas se envíen específicamente para personas de esa comunidad y que se reserven y no se abran a cualquier gente, porque, por ejemplo, cuando yo llevé a mi papá a Chula Vista, éramos 2 personas de color, los demás eran personas blancas, y estábamos en Chula Vista, donde la mayoría son latinos. Entonces, asegurarnos de que nuestras comunidades tengan un acceso a un número de citas específicas y así puedan tener la oportunidad. So, I guess I'll very quickly say it in English. We sent a letter asking for 4 specific things about removing barriers to access for Black and Brown communities. Those being having sites where people trust, like churches, institutions that people in communities trust. Second, eliminating paperwork. Even just today, I was on the scripts or on the Chula Vista website. They're asking for emails. Our seniors don't have emails. And so making it available on site without having to do that whole paperwork process. And then third is assigning specific amounts of vaccine appointments for the most vulnerable, and those that don't have access would be something great. And then measure that progress over time, because the first to get vaccines were not people of color, but we should be seeing the number grow, and it's sort of just been flat for a while. So again, I thank you for your work and everybody else who's doing work around this. Gracias.
Me and my unmuting. I love it when people ask questions or recommendations that I can say we are actually working on it, because it makes me feel good to know that that we've heard you loud and clear. So a couple of things. The first one on the issue of the database, right? So we are a pilot program with Los Angeles and us are part of the pilot program that the governor created for this My Turn thing, which is so complicated, and so we're giving them feedback, right? I think you all have heard me say before that at one point they were asking for social security numbers. Now you can actually put your ETH number, or you can put 000. And so that's like really good, especially for our communities of color. The other thing is, we've gone back and said to them, like, it's so complicated because you have to fill out all this information and then you get an appointment. So they're working on that as well, supposedly. This is like moving like the Titanic, right? I mean, I'm like, I don't, I worked in nonprofits where if we just wanted to change something, you just changed it. And government doesn't work that way. And so that's the piece I think it's really hard. And we have to figure out how to navigate around it, even though they're trying to move things up. And so the other part is Sharp and UCSD Health have their own systems as well. And they have requirements for the federal government. So we're challenging that. So just know that. So let me just say that really fast. que me gusta mucho poder dar la información a la gente para que sepan qué es lo que está pasando ya. Entonces, la primera es de que ya mandamos información porque somos uno de los programas pilotos, está Los Ángeles y San Diego, y hemos visto esas dificultades con la información. Entonces, estamos pidiéndole que lo cambie porque ha sido un impacto muy grande. Además, los proveedores de salud como Sharpie, UCSD, ellos también tienen su propia método de cómo tienen que tener su información, y eso está impactando mucho. En cuanto a las iglesias y los lugares que son de la comunidad, estamos viendo cómo hacer eso porque es un poco complicado. Cómo funciona la vacuna. Hay gente que son médicos aquí, digo, personas profesionales en cuanto a salud, pero como son unas botellitas de tamaño y tienes que dar cinco vacunas y luego tienes cierta cantidad de tiempo y luego la persona ya cuando le das la vacuna tiene que esperarse 15 minutos, es medio complicado el proceso. Entonces lo hemos hecho en lugares donde ya, donde no solamente son suficientemente amplios, pero donde la gente estaba acostumbrada a ir. Así que, pero lo vamos a llevar al comité para que la gente sepa qué está sucediendo. So, this idea of taking, and I keep saying this thing, right? We have to meet people where we're at. And I think everybody agrees with that concept. But the challenge is that the little vial, right? It's not a really easy process where you're just like, how like regular vaccinations, you have vaccines, you're supposed to distribute them between September and November. I mean, September and January, right? And you just give them out and people go and you get a shot. This is a little bit different because there's a lot of measurements and people are really figuring out how many vaccines per vial. Sometimes there's extras. The process is once you open it, you have to have it closed you have to get it done within 6 hours. And so it's not as easy as like grabbing these vaccines and just going somewhere and sas, you know what I mean? And you have to make sure that the person is not going to get sick. They spend 15 minutes afterwards. So even though we keep saying to people, es como la flu vaccine, right? Go get it. And it really isn't because it's something that we have to make sure that these protocols that have been created, I also think create a barrier, but it's really important to be able to meet the health needs of our communities. And so and then I think the other question was around appointment times. So we are actually now blocking specific times for our communities to be able to have these appointments made for folks who don't have access. And so there are going to be folks doing the intake, and these are trusted messengers, and we're reaching out to some of our community partners. It's actually going to start on Tuesday. They were going to start it this weekend, but they decided to wait to Tuesday because of the number of vaccines that we have. And so it had to be pushed a little bit. But entonces, en cuanto al tema de poder tener suficientes opciones para que la gente pueda tener vacunas sin que tener que esperarse, va a haber 100 promotoras que van a estar dedicadas y las están entrenando ahora para que vayan y ellas directamente llenen la información. Entonces nosotros recomendamos food bank locations, recomendamos las iglesias, diferentes lugares, ¿no? Que están abiertos porque ahorita con el COVID mucha cosa está cerrada. And so we're trying to figure out the locations, and I think folks in my team have been working on identifying those. People should know that the county did create constituency pods. So staff from the county is actually meeting with faith-based leaders. They've met with they have a weekly meeting with some of the nonprofit organizations that are providers that include the Chicano Fed, includes San Isidro Health Center. I think, isn't PIQE part of it too, Pati, right? So there's a lot just so you know, there's a lot of community input that has been given to the county and a lot of this work. So I want to make sure people know that. I think I answered all the questions. ¿Quién sigue? Why don't I let people just kind of give their opinions, and then I'll ask their questions and stuff, and then I'll just finish so that I can have enough time so everybody can chat. So Mirna?
Hi.
Maybe Grisel, who's next, but go ahead, Mirna. Thank you.
Hi, Supervisor Vargas. Muchas gracias. Thank you so much to your team as well for providing the space. My name is Mirna. I'm from Casa Familiar, and I also have with me Cristel, who's a promotora, assisting with COVID efforts. Entonces, my first one is with testing efforts. So we're partaking in a project led by San Diego State that focuses on providing rapid testing for underserved communities. We're having a really difficult time finding a location to provide rapid testing. Entonces, specifically in the 92154. And the location that we have been able to find is with a church. Entonces, we do see the value of churches. But aside from that, we're having a challenge. So if you have any contact information in the 92154 area, please let me know. Because we have until the end of March to provide rapid testing to this community. And then in regards to vaccination, I agree with everything that has been said. Really quickly, thank you for advocating to provide vaccination sites in our communities. Pero yes, I agree. It has been a very challenge to obtain appointments. Even after I have seen the changes that have been made in the website, and thank you for those improvements, because we were filling out the application and then we were sent to appointment options, pero ya no había. Entonces, and that would go in a matter of seconds. So I appreciate the in-person, the intakes that will be happening. How could we get this information so that when we're getting phone calls and our promotoras are getting those questions from our community, we can send them to the appropriate locations, and not only to the county website, porque como han mencionado, navigating a website using the internet, whether it's in a phone or in a computer, laptop, that doesn't work for everyone. And then for undocumented families, that's also a concern. So how are we ensuring that all the message that gets out there is welcoming? Porque todavía hay ese concern that, okay, they're going to ask me for my social security, or even if they don't have a Mexic document that you mentioned previously, entonces, ¿qué pasa? And to address also the misinformation, how can we go about that as well? And then also, lastly, providing support to nonprofit organizations who are receiving these questions. What is an additional resource that we can connect them to? Aside, like I mentioned, to the county website, is there a phone number? También, I've heard a lot, the 211, pero even calling 211, it won't happen.
No, minutos de espera para el 211, ya les dije. 211, 45 minutes to get a call in into 211.
Sí,
right?
sí, entonces an answer that I have is maybe provide support in the sense of providing a training to our promotoras that's provided by the county that could give them accurate information that they can later connect the community to.
I love that. The trainer program model really worked well. That Planned Parenthood, me encanta. Sí. Entonces, toda esa información, primeramente, creo que es importante que nuestras comunidades reciban mucha información por medio del radio y la televisión. Y los reporteros estamos trabajando con Univisión y con Telemundo y estamos viendo qué otra manera podemos hacer. Estábamos hablando como de un teletón en donde pueda estar una persona que sea un médico y alguien del condado, ya sea yo otra persona, y que está hablando con la gente lo que está sucediendo para que la gente tenga la información y pueda hablar y preguntar. Ya ves que eso sí funciona mucho, ¿no? So we've been talking to Univision, and Telemundo has been very helpful as well. In making sure that we're getting the information out. But I was telling someone, and I think I've spoken to Norma Chavez about this. We talked about it during the COVID piece, right? I think we need to get like our influencers, like our radio DJs, our folks that people care about. Porque mira, you know, I've been in this job 5 weeks, and I guess people want to hear from me, pero la verdad, like, people really want to hear from, like, the cool people out there, right? And so, not that I'm not cool, pero I just think that it's really important that people who, like, the people who they connect with, the people who they know, and so I think that's something that we're going to work on and to do a better job on. Lo que sí, no sé cómo poner la información ahorita, pero antes de que se acabe le voy a pedir a Isela que lo haga. Lo que hicimos nosotros es crear un documento que se llama COVID-19 Vaccine Frequently Asked Questions. O sea, todas las preguntas que tenga la gente sobre la vacuna, y la estamos haciendo, no me acuerdo cómo se dice update en inglés. La estamos continuamente, le estamos poniendo la nueva información para que ustedes la puedan usar, y va a estar en inglés y en español. Ahorita les voy a enseñar la que está en inglés para que la vean. para que sepan cómo está el documento. Tiene todas las preguntas que puedes saber, o sea, y los lugares donde puede ir la gente a tomar, a hacer el examen, qué documentos ocupas y todo lo demás. Nomás estoy esperando que terminen la información en español para que toda la gente la tenga. Lo que hice yo es crear un equipo, con mi equipo, con Griselda, es que nosotros vamos a estar enseñando la información directamente a las personas que están aquí, a cualquier persona, les vamos a estar mandando información como salga. Entonces, es importante, ya tenemos una lista, pero nunca, esa lista pues nunca es suficiente.
It's always evolving. I could share the screen. Puedo compartirla.
Really quickly, para que lo vean. Y mientras, si alguien quiere hacer otra pregunta, mientras que Griselda pone el documento para que lo vean. Y Mirna, yo me encargo mi equipo se encarga de mandarles información. Como sabes, David Flores está trabajando ahora conmigo, así que no podemos dejar de darles información.
Olympia is next. So this is what the document will look like. Va a estar en inglés y en español. Estamos terminando, pero tiene todas las preguntas.
Ajá. ¿Cuánto cuesta? Los lugares, puedo ir directamente, qué son las superstations, qué documentos ocupo, mi estatus migratorio. Yo sé que mucha gente no lo puede tener esto, pero yo estoy, por lo menos es la primera parte, ¿no? Para que la gente tenga la información. And so it's going to be in English and Spanish. If you have any recommendations when you see it, feel free to let us know. We'll add more stuff. We're trying to put it out in social media. If you can retweet or put whatever we have, just send it out to folks so that people can get the information. I think that's really important. Olympia.
Gracias, Supervisor Vargas. For those that don't know me, I'm a nurse contractor with the County of San Diego. I work primarily in City Heights at the Central Region Public Health Center. We're one of the county sites that works with undocumented community members, and that's a very vulnerable patient population. One of the things that I wanted to recommend is that we can update Assemblymember Lorena Fletcher's website. She does have a list of resources there when it comes to how the pandemic, or resources available to undocumented families regarding COVID, where people can go to get tested. But when it comes to the vaccine, that information is absent. So maybe updating that particular website with information related to the vaccine and who's eligible, that information that was just shown about frequently asked questions, that's really important information that would be perfect for that particular website. And then make that information that is on Assemblymembers Fletcher's website available offline. Like David Alvarez said, a lot of our elders don't have social media. A lot of the information that is being shared right now because of the pandemic is being shared online and through social media, which helps a certain demographic. It helps our younger generations, and we're heavily relying on that generation to share with our elders. A lot of times our elders are talking about this information amongst themselves at food banks, at grocery stores, at clinics, but that information is not necessarily posted in both languages in those spaces. A lot of the information that I notice is available in clinics, in waiting rooms, in libraries, is a lot in English. So these are just things that as a nurse, I'm noticing in the spaces that I frequent. And in my particular clinic, we try to make sure that we have a lot of multiple language information available because of the patient population that we serve. But when I'm personally out in the community, when I go to una cita, when I go to my own appointment, I notice that a lot of the information that I see at my own appointments for my own personal health are a lot in English. So one of the things that maybe we can do is create educational information in Spanish and make sure that they're available in spaces that our elders are going to frequent, at the library, at the grocery store, at the lavanderia, at the panaderia, and talk to our places like David Alvarez spoke of, but places that our people have confidence already, and donde se sienten más cómodos, y en donde se pueden leer con confianza esa información. And I also agree that having faces that people trust, faces that people can relate to, that's also very important. And I think having Señora Esperanza last week was really powerful. And if we can maybe feature on these conexiones, maybe one elder to talk about their experience receiving the vaccine. How did you feel? How was the process? Who helped you? We in the county, we often have what's called a blitz. Like when we had the hepatitis A outbreak, we just had a bunch of nurses go out into the impacted community, go offer the vaccine, like just a big 1 weekend, go out there and handle it. Well, maybe we can go out and do the same kind of thing at, let's say, a food bank or at a food distribution, but instead what we're doing is making appointments for our elders. We all go out there with laptops. Have you had your vaccine yet? Can I help you make that appointment right now? And that way, you know, we're all supporting our elders get that done. And we kind of, you know, bridge that divide, that cyber divide of having access to a computer or knowing how to operate it, or relying on somebody in their home being able to do that for them. So those are just some things that I have been thinking about.
Yes, and I love it. I feel really validated right now. And my team, I think, but so one of the things that I really don't want to be a negative Nelly, but here's the thing. We have, this week, I think we have 10,000 vaccines between Thursday and Sunday. So we are trying to figure out how do we get to the 65 and older, right, folks, to get them to what they need, and create and having a lot of these discussions about how do we get it out there. I think on Monday we get another 45,000 for the week. So the vaccination process is so slow that I think it also hinders the appointment process, right? So in addition to all the other barriers. So know that that's also the other piece of it. So it's not an excuse, but I pride myself in being a very transparent public servant, and I'm going to keep telling you the truth, even if people don't like what they hear, because I want you to know that the reason why I'm having this conversation with all of you and why we want your feedback is so that we are fixing it as we go and creating a structure that is as good as it can be. Because I have this dream that the vaccines are going to come all at once, right? It's like, and then that's, I think, what Chair Fletcher and I talk about. We just have to create an infrastructure, and then we're going to have it ready to go. So all of these are great. We talked about, you know, people in our communities go to the supermercados, right? And they, you know, there's like morning sessions now for them to go to. And so where do we put this stuff? So all duly noted, and I love the ideas. Así que me da gusto saber que todos están pensando en diferentes maneras. Vamos a tomar toda esta información y tratar de usarla, pero es importante, pues desafortunadamente la distribución de vacunas está tomando muchísimo tiempo. No hay suficientes vacunas. Tenemos como 10,000 vacunas de ahora hasta el domingo. Y los números cambian todo el tiempo, ¿eh? O sea, yo te puedo decir 10,000 ahorita y mañana va a haber 20, porque dependiendo qué pasó, alguien no las usó, no las mandan. Entonces, la estrategia que estamos usando en el condado es que vamos a tener los sitios de vacunación y vamos a buscar mejorar el sistema para que funcione y luego buscar de una manera, pues ya que lleguen todas las vacunas, que la gente las tenga. A ver, ¿quién seguía? Jason? Jason, uh-huh.
Good afternoon. First, on a personal note, I love all of this Black and Brown community talk. I feel like the two communities have worked in silos for way too long. So thank you for that. My question is in regards to, surprise, surprise, the border. Wondering if are we having binational coordination with Baja California? Understanding many of the decisions, certainly on the Mexican side, are going to be federal level, and we don't quite. Well, I guess my question is, do we know what Mexico's plan is? Do we have a binational coordination? And I'm not talking about vaccines going on one side of the border or the other. I'm just saying the way that we vaccinate, the systems that are in place and so forth. Is there some kind of coordination? Because the obvious reasoning is because of the enlace, the daily back and forth between our two communities. It's not going to do South Bay to be any good to be 75% vaccinated and 15% on the Mexican side, right? Or vice versa. We used to always kind of tongue in cheek say, you know, when San Diego sneezes, Tijuana catches the cold. Well, now it's literal. So I'm wondering if that is. And then also maybe Griselda, we could talk offline. I'm part of a group that's giving detailed suggestions to Homeland Security and Department of Transportation. President Biden has given them 14 days to come up with safe corridor plans that includes the land port of entry. So any ideas on that as well? Mi pregunta era simplemente si hay coordinación entre Baja California y el Condado de San Diego en cuestión de las vacunas. Debido a la vida binacional que vivimos, no nos favorece que una comunidad está vacunado y la otra no, perdón. Entonces, mi pregunta es, pues, si hay coordinación, ¿cómo es la coordinación? Y si sabemos qué es el plan en México. Thank you.
That is such a perfect question, because I think we forget sometimes that we are a regional community and the power of that. So I don't know if you've heard us. I'm assuming everybody listens to our press conference on Wednesday at 2:30. But that's a really great place. I'm all kidding aside. That is a great place for everybody to get information on a weekly basis. It's a little bit, there's a lot of information that we give out, and I do it in English. And Chair Fletcher does it in English. I do my portion in English and Spanish, and we try to answer questions to all of the mediums, and it's the first time that it's ever been done that way. So just know that. Entonces, esta pregunta es sumamente importante porque como región tenemos que ver este problema, ¿verdad? Y cómo resolverlo. Y quiero pues invitarlos a que vean la conferencia de prensa los miércoles. No la tienen que ver toda, pero para que sepan que ahí está a las 2:30. Estamos en vivo dando la información lo más pronto posible, lo que está saliendo, así como dicen, pan caliente, ¿no? And the other thing that people should know is that there is a binational committee that was created, and I think all of you know my chief of staff, Denise Garcia. She was one of the initial folks who helped create this committee when COVID hit, when she was at the mayor's office. So I'm really proud to have her on my team, leading some of those efforts. Know that those meetings are taking place. They take place on a biweekly basis to figure out the impact. That's where the COVID testing came out of, to be able to do the COVID testing at the border, right? And then I'm having conversations with the consul and the Secretario de Salud de Baja to really figure out what else could we do together. The other thing that's important to note is, and I think we have to remember this, we have a large population of residents and U.S. citizens that live on the northern Baja side of the border that we have to account for, right? We talk about 3 million people who live in the county of San Diego, but people forget there's a whole bunch of other folks who are U.S. citizens, who are legal residents, who are living there for whatever reason, right? By choice, necessity, whatever it is. And so they also should be accounted in our overall projection. And so we have brought that up, and it's understood that they are going to be doing this. And so, para que todo el mundo sepa, es importante que sepan que sí estamos teniendo las negociaciones y las conversaciones. Yo tengo juntas con el secretario de Salud, y también con el cónsul de México, pero es importante pues reconocer que somos una región y todo nos impacta directamente. And, I know we're almost out of time, but I do want to say that, Jason, I also know the impact that not having Mexican nationals be able to cross the border has really impacted our region, specifically our community right now. And so we take all that into account as we are really moving forward. So just know that I'm very mindful of that. I have a lot of cousins and friends who can't cross the border because they all tell me, right? I mean, like, it's kind of silly, but it's really true. They're like, I just miss going to the outlets. That's what they tell me. So, I know that's really dumb, but I like it's where people are at. So, estamos viendo toda esa situación de lo que está impactando, pues, de que las comunidades nacionales no pueden cruzar, pero pues ahorita tenemos que hacer todo lo posible para contener la pandemia. Geno, you had
I did, Supervisor, I'm sorry, but I did want to thank Denise Garcia and Barbara Jimenez from the county. They've done a great job at communications through the COVID piece. I just wanted to make sure that it was still going on the vaccination part, and I'm glad that you're having those meetings as well. So thanks.
Now we're going to the next one, but we're the second phase. So thank you for that, Geno. And then I have to go because I have another meeting at 1:00. Dios mío, Geno.
Yeah, I'll be quick. Nora, I think I like the idea of the promotoras. I also think, just a suggestion, I have worked with promotoras in the past, for the promotoras to know the leaders of those communities, so then they can be letting them know where to go and who to connect with, because everybody knows their community very well. So you need to connect. I would like to work with Grisela to connect them, especially in my community, to see where are the places and then get all the details, because we have a lot of elders. Like, I'm not going to mention what everybody already mentioned. Also, at the same time, I work with SEIU USWW, and our members are dying, Nora, in the airport. And I've been telling you, everyone, single one. And the government excluded us as essential workers. And it's been hard on us in our union, seeing our members die for the only basic necessity of surviving, because they have to go to work. Either they work or they get fired. You have to go to work to be able to provide, but a lot of them are the sole providers of their houses. So also, if you can help us be an advocate of, like, our members are essential workers, people are still traveling, and a lot of members of the airport, have been dying, and we were not included in the vaccine and the priority of vaccine. And it just shows, and I'm not afraid to say it just shows the discrimination that we're facing of our health. In this majority of my members are immigrant women, older, and someone talk about, I had a tia call me. She's like, I'm so excited in Tijuana. She said, they call me. O sea, no one here has called them. They call me. They took all my details. Now I have my appointment. How beautiful is that? And I hope that the promotora learns from the community and gets that information. At least, right now we're fighting to get our members the vaccine, especially the ones who are working. But it's really good that we have the promotora, but the promotora is really doing their work, because we can have all the promotoras out there in the world, but if they don't know the community, they don't know where the panaderia or the laundromat or where the señora who knows everybody else, or the church lady, we need to have who will meet La Señora Esperanza in our community, And so I think that's what we need to do. And so hopefully, Grisela, you have our emails that you get us involved, and for us to be spokesperson. My whole family got sick. It's a horrible experience, feel traumatized. Hopefully later you can have a conversation about long haulers, because we're still lingering a lot of effects, and we're still having full recover. So I definitely thank you so much for opening this space to talk about it. But there's a lot of work, and count with our support in whatever we can to help you in this.
Gracias, Genoveva, and thank you for sharing the story of our janitors. And I think to your point, I think it really demonstrates the inequities within the healthcare system, and these regulations that come from the CDC about who goes first, and been a lot of conversations about our farm workers, and so I think we're part of the reason why we're trying to move people fast enough is we can get to that phase and make sure that people get and I know I'm going to go speak to them tomorrow, and I am going to continue to do everything I can to fight to make sure that we get people the vaccines that they need, and make it get it processed as soon as possible. So I do have to go because I have another meeting to go to because right now everybody has questions around vaccines and COVID and everything else. And so I'm trying to do my best, but I want to say thank you everyone for your time, your trust in our team to be able to share your concerns and recommendations. We are taking everything and we're writing it down, and everybody's working around the clock because we want to make sure that everyone in our community is vaccinated. And so keep bringing the suggestions, keep sharing. That's what we're here for. And I look forward to working with all of you. Así que muchísimas gracias a todos los que nos acompañaron ahora. Gracias por todas sus recomendaciones. Toda esta información nosotros la vamos a tomar y llevárselas al condado para que sepan lo que necesitan. Aquí les pusimos la información. District 1 Community at sdcounty.ca.gov es el correo electrónico. Lo vamos a poner para que la gente lo tenga en el Facebook también. Pero es muy importante, muy, muy importante que, pues, que nos enfoquemos en vacunar a todas las personas en nuestra comunidad. Así que mil disculpas que tenemos. Yo creo que podemos seguir platicando sobre este tema hasta mañana porque hay tanto trabajo que hacer. Pero yo me comprometo a que Griselda Alor te hable y cualquier otra persona que tenga cualquier otra recomendación, ¿ok? Muchísimas gracias. Que tengan bonito fin de semana y muchas bendiciones. Thank you, everyone. Thank you.